I'm James Sandow, I'm Professor of Urological Surgery in Aberdeen, and I'm the Adjunct Secretary General in the EAU responsible for the education portfolio. So I'm the Academic Coordinator for Pioneer representing the EAU.
Hi, I'm Susan Evans Axelsson, Medical Advisor at Bayer and the FPA Lead of the Pioneer Project.
Well, it's been a huge success, and despite our initial anxieties at the start, we managed to create a neutral platform where academic centers that were represented, patient organizations, and others from the public side gained confidence in the neutrality of the consortium. And that has been a huge success in my view.
I would have to fully agree with you on that. I mean, what we've learned from the project is that success is measured differently depending on who you talk to. And we can't underestimate the power of the consortium that we have. We have really grown into a family, and we often call ourselves a Pioneer family. So I think that that's something that should really be celebrated with the people that we have and that we work with. I always know that I can call you and count on you to help me, or if I need something else, I know that we have people we can call and count on, and that is something that's grown within the consortium. We have that, and that's not really thought of because it's not that tangible thing that you touch. But then we have much more than that, the platform, amazing platform.
And of course, not to forget the data partners that have gained a lot of trust in the consortium and how we work in sharing data, including sharing it on the central platform with more than 40% sharing data centrally. This is
amazing.
Yeah, something we did not expect, obviously. I think from my own perspective, it's been an amazing experience to do research differently. Traditionally, we as researchers operate in our own silos, do a research project with our own research teams in our own institutions. What we have managed to do with Pioneer, obviously, is to get researchers to not only carry on doing what they were doing before, but to also share data and do collaborative research with larger data sets and data partners, sharing experiences and having other disciplines like epidemiologists, health economists, and others to support them in the research they do. And I think that, for me, has been a huge additional value to how prostate cancer research not only has been done in the past 5 years in Pioneer, but is actually the future.
I mean, on this, you're working with the patients. You see how we can help them and how we can help support them. But what's really been great within the project are the patients, the contribution from the patients that we had. When we received the questions, when we had the questions developed, they were developed with thought leaders, and they were developed with the EAU guidelines, but also with patients, so that the patients could have their input up front. What do you find most important? So we knew from the beginning that the doctors and the patients don't always find the same things important. So having them involved at the beginning, we know that what we're doing is going to help them. You're with the patient, I'm not with the patient. So you're with them, so you're gonna experience and see and be able to talk to them and see how we can also grow within Pioneer, how we can expand and really do work that is for the patient, that is for the patients and their family, because, you know, like we've heard, it's not just the patient and it's their family on this journey.
Actually, the project's not ending. I think, yes, we have come to the end of the IMI grant period, 5.5 years. But actually, society, a professional medical society, the EAU, European Association of Urology, is actually never been in Pioneer for 5.5 years. EAU came in to build for the future and for the next generation. So for us, this was the first step, completing the first phase, building trust in the consortium and the partnerships. But actually what has transpired is actually our experiences in Pioneer have transformed how the European Association of Urology regards real-world data, real-world evidence, and led to the complete commitment to a digital transformation of a professional medical society. This is huge, and is the first that is happening.
I mean, it would be terrible that we developed such a great platform for it just to stop. When we speak with the current data providers, everybody sees the benefits of this. They see the benefits of going forward with this, and they're on board to stay with us, because we can only keep growing. You develop such a great platform. A lot of work went into developing the platform to make sure that we could do this type of research, that we could answer these type of questions. It would be an absolute shame to end just when the initial granting period ended. So we will sustain the project. It will go forward. We have support. We have support from patients. We have support from data providers. We have support from clinicians. We have support from EAU. So it would be a shame if it didn't go forward, and I'm so happy that we will be able to go forward with the Pioneer project.